Reverse shoulder replacement. In this video, we're going to walk you through the intricacies of a reverse shoulder replacement procedure. This cutting-edge surgical technique is the most reliable for addressing rotator cuff failure, coupled with wear and tear, and arthritis. The rotator cuff, a cluster of muscles essential for shoulder movement, becomes compromised and irreparable when damaged. This unfortunate situation results in a loss of function at the shoulder's ball and socket joint, causing not only discomfort but also functional limitations. The shoulder joint, scientifically known as the glenohumeral joint, resides between the head of the humerus, the upper arm bone, and the glenoid cavity of the shoulder blade. In a reverse shoulder replacement, this anatomy is reversed, effectively switching the ball out with the socket, and the socket out with the ball. A series of specialized instruments come into play. They are employed to shape the socket to precisely match the implant that will be securely affixed to the bone. The size of this implant is customized to each patient's unique anatomy. The surgeon begins by carefully removing the damaged area with a precision saw. The next crucial step involves preparing the humerus. This is done by inserting a set of instruments down the bone's canal to determine the ideal implant size and angle. A portion of the bone is then expertly removed and smoothed to create the perfect foundation for the implant. Finally, the reverse total shoulder replacement is assembled. This consists of a ball attached to a metal plate, and a socket affixed to a stem that is securely placed into the humerus. This comprehensive procedure marks the conclusion of the reverse shoulder replacement surgery.